There are 5 different causes of iron deficiency anemia. So the first would be poor dietary intake. So now when we look at poor dietary intake, we divide the source of iron into 2, heme and non-heme. And basically it means number 1, it comes from plant-based versus the second one comes from animal-based. So when we look at plant-based source of iron, we are looking at all types of green leaf vegetables, your spinach, your broccoli, your beetroot. Yeah. However, the issue here is only 5% of the iron from this source is being absorbed into our body versus animal-based, for example, red meat, chicken, fish, pork, eggs. Here, the absorption is about 20% as compared to the plant-based. Therefore, that's the reason why we notice that patients who are vegetarian tend to develop iron deficiency anemia. At the same time, iron is not absorbed on its own. It needs the help of vitamin C. That's the reason why even after you have eaten a good meal of iron, patients need to take fruits or vegetables that are rich in vitamin C to enhance or to help the absorption of the iron. Now, let's look at the second cause of iron deficiency, chronic blood loss. So there are multiple reasons or factors that can lead to blood loss. So first, looking at heavy menstruation. We tend to see about 30 to 40% of women in their childbearing age tend to develop iron deficiency anemia due to heavy menses. Number 2, we also notice patients having gastric ulcers, gastritis, okay, which basically leads to slow oozing of blood or having poor absorption due to high acid contents in their stomach. The third reason, which are very common in Malaysia due to our dietary pattern, which we tend to eat very spicy food, basically leads to the development of bleeding hemorrhoids. Patients tend to lose blood slowly from their hemorrhoidal bleeds. The third cause of iron deficiency anemia can be due to chronic inflammation or infection. For example, in patients who have got chronic diseases, for example, heart failure, chronic kidney diseases, and patients who are suffering from cancers, who are undergoing chronic treatment. Yeah. The other cause of iron deficiency anemia can be due to increased iron requirements. For example, number 1, in young adults and teenagers where they need more iron requirements due to their day-to-day activities and robust activities in sports and etc. We also tend to see iron deficiency anemia very apparent in women who are pregnant in their 3rd trimester. At least about 60 to 70% who are actually iron deficiency due to the increased requirement of nutrition as they are about to deliver. And the last cause of iron deficiency is related to poor absorption. For example, in patients with inflammatory bowel disease, where the iron absorption is not taking place properly, leading them to have iron deficiency anemia.